Welcome back to Born for the Stories, where we speak the truths no one told us, so you don't have to carry this alone. Most of the parents who've sat in this space with us made the same choice that we did. They got the diagnosis, they found the best surgeons, and they walked into the operating room. But today's guest did something different. She asked a question most parents are afraid to even say out loud. And then she trusted the answer. 7 years later, her son is thriving, and she's here to tell you what that actually looked like. Lindsay is a mom of 3 from Vermont. She's a fascial therapist by trade and one of the most grounded people I've spoken with about this journey. Her son was diagnosed with hypospadias, and her family made the decision to not operate. This is her story.
Lindsay, thanks again for joining us today and telling your story. First question is just tell us the basics about you and your family and how many kids you have and all that good stuff.
Yeah, my name is Lindsay Corsell. I live in Vermont. I am a fascial therapist, so I'm a manual therapist primarily working with fascia. And I have 3 kids with my husband, Scott. We have 2 daughters and a son. My son's in the middle. And they are 10, 7, and almost 2. Wow. And I love being a mother, and I love the human body, and I loved being pregnant and birthing. And so I'm just always fascinated to have conversations and think deeply about the body and do research as well. But I would say I'm more of an intuitive, my intuitive brain is much more exercised at this point in my life. And so, yeah, I'm excited to just get into this whole story of my son.
Yeah. Well, we can dive right on in. You can really start wherever you want.
Okay.
Tell us about the process. Yeah.
Yeah. So I will just mention that with my first baby, my daughter, I had sort of a traumatic hospital birth in that I was induced, and it was just really hard kind of coming into motherhood. And so with my son, when I was pregnant with him, I was very focused on doing everything I could to make the birthing experience ideal. Mm-hmm. And so I was doing a lot of body work. I was receiving a lot of different types of body work myself. That's just, I'm oriented to body work. So that's what I did. I felt like I was really on it with nutrition and maybe a little too focused on trying to do everything right. I'm not sure. It's just in hindsight, I can see that I was definitely really focused on that. And then my son came super fast. So I went to 41 weeks, and I chose to go back to the same birthing center with the midwives at this hospital, mostly because of my experience with my daughter. And as much as I kind of wanted to explore home birth, my husband was kind of scared because of the experience we'd had. And it also at the time felt like an expense that we couldn't really take on. And so we kind of explored that and then decided to go to the same hospital, which was an hour away. And so I labored for 1 hour at home, 1 hour in the car, and 45 minutes. And then my son was out.
Wow.
It was a very quick process. And so immediately after he was born, I remember just, feeling great relief, as most women do when their baby is born. And it was so much quicker than I expected that was a little bit surprising for me. But so I was in a little bit of shock around that. But I was really excited to have a son. I knew I had one ultrasound during that pregnancy, so I knew it was a boy. And at some point in those first couple days, I guess, I can't even quite remember, I remember looking at his penis and seeing that his foreskin looked a little bit different. Mm-hmm. And the pediatrician on the rounds at the hospital who came in said, it's a shawl foreskin. That's what she called it. I don't know if you've had other guests call it that before.
No. Mm-mm.
Like a shawl, like a scarf that you can wrap around your...
Yeah.
And I was kind of like, okay, but she didn't say the words hypospadias. She didn't really tell me anything more. And it just left me with this curiosity. And then our family doctor is a naturopath, and we went in for, basic kind of, I don't know, we probably didn't do every early checkup, but we definitely took our son at least, once or twice in those early months, I don't know, whenever. We're not entirely on the schedule of checkups and well child visits. And so, and he definitely got checked out, but I don't remember anyone really saying the words hypospadias or telling me about that.
Yeah.
I just had this curiosity of like, what is this shawl foreskin? And I don't feel like I could really find much about it online.
Right.
And so I just eventually was like, I'm going to take him to a urologist, and I wanted to learn more about like, what is the deal with this? And so that was around, and we had some other issues in those early days. He did have, because this is a midline defect, he had an upper lip tie.
Yes.
I'm guessing he had tongue ties as well. I'm guessing, at that point, I knew a lot less. I mean, it wasn't that many years ago, but I've learned so much more since then. And I work with those in babies, infants, kids. But we had a lot of trouble breastfeeding. It was just, he had a shallow latch. It was painful. So I was really focused on that.
Sure.
And he also had some fascial restrictions that made it seem kind of like torticollis. And his head was, he had a preference for breastfeeding on one side. And so we were working with those kind of things. And that was where like a lot of my focus was going in those early months. And then when I think he was probably maybe like 6 months old, I got him into the urologist, and I went alone. I took him to the urologist, and, they immediately just, they really retracted his foreskin, said, yeah, this is, his urethral opening is a bit lower. This is called hypospadias. They also diagnosed him with mild chordee. And it was very much the urologist, like, no big deal. You're going to bring him in for one surgery at, I can't remember if they said 12 or 18 months.
Sure.
And the bedside manner of this urologist, this is at Dartmouth, which is a amazing, for a hospital in our area. I just was shocked at like how he delivered that news to me. And I immediately started crying really hard. I am not someone who suppresses my emotion when it comes up. And I remember there was either nurse or maybe like a student urologist or something in the room who I could see she was like wanting to comfort me, but then the other student or nurse and the doctor were just kind of like, it's no big deal. You don't need to be upset about this. And I was kind of like, are you kidding me? Like, this is a big deal. This is a big deal. And I remember getting on the phone with my husband and immediately just saying like, we have to do surgery, that, this is what the doctor says. And as I heard you speak about how, kind of how holistically minded you are, I'm also very holistically minded. My work is body work.
Yeah.
My brother is a chiropractor. I grew up with my dad's side of the family. They're Christian scientists. There's a lot of like no medication unless you absolutely need it. Also not like crazy, not like we never go to the doctor or something, but we're just, my family, I grew up more naturally focused. Yeah. If I was going anywhere, it was probably to a chiropractor.
Sure.
And so, and I haven't had any real major surgeries even myself. So the thought of my baby having surgery was really intense for me. And as it is for most parents, right?
Yes.
And so, my husband was just able to be like, okay, just, stay calm. Like, we're gonna talk about this when you get home. Just, it's all gonna be okay. Like, no matter what, it's all gonna be okay. And so I went home, and I think like any parent, I was immediately, Google searching and found some Facebook groups, and I found such a range of those Facebook groups.
Yes.
There's and I agree with something I heard you say is they're very black and white. It's like often it's either like absolutely not, no surgery, or like, yes, like this is the way. And I remember the urologist saying, he could have problems, or like he won't be able to pee standing up. He could have problems with fertility and telling me those sorts of things. So that all felt really scary to me,
Absolutely.
As it does for all the parents who get this news, I imagine. And I didn't know of any family history of hypospadias. No male relatives that I know of have had that diagnosis. I do kind of question whether there are men who have it mildly and maybe don't even realize it? Or
Sure.
are we really the start of this? I have no idea. But I basically just in doing more research, I just decided, well, my husband and I decided together that we were just going to kind of wait it out a little bit and see how it was for him over time. And I immediately just thought of the fascia, which we can get into more later, but
Sure.
this head to toe web of connective tissue. And obviously he had a tight midline because he had these oral ties as well. But I just thought like maybe there are ways that I can do some work to release his tissue so that it's not so tight.
Yeah.
And so I started working on him more when he was a baby.
Oh, I love
and
that.
and after a while I kind of fell off of that. I was definitely really tied to like this is what I'm going to do as very regular practice for a long time. And I have not specifically worked with that part of his body again in a long time until this morning, because I was just really like, wow, I really haven't talked with him much about this in a long time. And for me, it's like I don't want to make anyone feel wrong for their choices. This is such a complicated issue, and some
Absolutely.
people are going to choose surgery and some people aren't. And for me, it was this idea of knowing I work a lot with surgical scars. I know that there's scar tissue. When I read about the potential for subsequent surgeries or, I don't want to say errors, but just challenges with surgery, that was enough to make me feel like, okay, like if he's not having any actual problems right now, and it's a mild case, how much of this is cosmetic, and is this something that I really want to decide right now to potentially have? I mean, this is what we're doing all the time as parents. We're weighing the pros and cons,
Absolutely.
and basically, like, is my child going to hate me eventually for
Yeah.
choosing one or the other?
Yes, 100%. Yes,
And we have no
felt that.
control. At the end of the day, like we have no control over that. We just have to make the best decision we can with the information we have. And I just also, from my research that I did, recognize that like probably most urologists I was going to take him to would tell me that surgery was the answer.
Sure.
Maybe some wouldn't, but that's really, we all have our own biases, right? Like a surgeon, their whole purpose is to cut into bodies and repair.
Yeah.
And me, I'm a body worker, so I'm very oriented to like, how can we do this with our hands and not with surgical tools? And so I just thought, maybe it's possible that he's not going to need this surgery. And so I guess we kind of made that decision, and then I don't feel like we've even really revisited it that much over the years, because over time the chordee has just disappeared. He stands up to pee. He doesn't have any issues that I can really see. The one thing I will say that I think is interesting is he does seem to have a little bit of challenges with his interoception, kind of internal feeling in his bladder, or maybe it's in his urethra, I'm not sure, but it's like there are times when he just kind of goes off the walls, and I'm like, do you have to pee? And he's 7 now, so he doesn't have accidents or anything like that, but it's like he just sometimes when he has to go to the bathroom, like I can see a change in his behavior. And I find that interesting. And I'm kind of like, what is that? Is that just like things are tense? And as his bladder fills up or whatever is going on down there, that something shifts in his ability to kind of regulate himself.
Right.
So
Right.
I don't know if other parents have that experience. I've never tried to talk with anyone else or look that up. Do you have any knowledge of that sort of thing?
No, the only thing I will say, and I'm glad that you mentioned this, because again, it's like, it is nice to talk to someone else that, kiddo has something similar and things, but our son is potty trained, but there are definitely times that he will hold his bladder for a very, very long time.
Yeah.
And so I do feel like possibly, without knowing, that the repair hasn't like decreased his like brain and body connection, but it's almost like a little lag at times where he has had more accidents than our older son ever did, you know?
Gotcha.
So there does
Yeah.
seem to be a little bit of lag.
But he
times.
also potty trained way earlier
Oh yeah.
than our older son. So our older son, by the time he committed and said, "Okay, I'm potty trained," like I think all the feeling was 100% there, and he really understood it. He just didn't want to. Whereas our younger son started potty training, and I think he didn't even know like that was the goal. He just did it because his older brother was doing it, and he was easy.
Yeah. Yeah. In that regard, he was easy, but like from another like perspective of like being in this like holistic space and working with bodies and understanding like the input and the communication, that's always in the back of my mind. We had actually went back recently at the end of March to the Hypospadias clinic because our son had some suture tracks that were showing up, and that was like, it was a super easy procedure. But when we were there, they checked his bladder and they checked like his output. And she basically was like, everything's great. But I know if I would bring those things up, because they don't think like this, that it would be like, oh, that's just like normal for like a 3-year-old, you know, like just normal behavior or normal this and that. So there are things that I question.
I feel like that's tricky in general because, you know, now as a parent with 3 children, they are all so different.
Oh, yes. Yep.
The way that they've weaned, the way that they've potty trained, you know, like it's just some of it and even just my son's personality, he's the middle child. He's definitely like a button pusher. And he has moments like that. And that can be one of the things when he has to pee, where I'm like, okay, you must have to pee because you're just suddenly like being like purposely just pushing the buttons of everyone around. And he also just is so sweet. And, you know, it's like some of it is just who he is. Like he's this fiery little spirited guy. But then I have these wonderings of like, I mean, there's a couple different things that happen. One other thing that happened to him early on was having his heel pricked in the hospital and not being able to get enough blood. And it felt traumatic. And I'm, you know, as a parent who's attuned to trauma, it's like, oh, that was traumatic and that was traumatic. Yes. And it's easy to just kind of try to make meaning of things when at the end of the day, it's hard to know. It's hard to know what causes what. Definitely, I think our body holds on to the experiences we have, but it could be, you know, from trauma that we've experienced, it could be the littlest aspect of that is really kind of stuck in your fascia from what my experience is and what I witness in other people. So I don't know, I try to just kind of take the pressure off myself as a parent and say like, okay, we're doing the best we can. Yes. Some of this is who he is. Yeah. Some of it might be from having this tight midline that has never been corrected. Mm-hmm. Who knows? You know, it's just hard to say. And I don't think we'll know ever, but maybe over time we'll have a little bit to kind of judge. So he is now 7, and I've spoken with him about his penis from time to time. And we did have some challenges in his early years with yeast. That was definitely like, he's uncircumcised, which from everything that I've learned, that seems like the best option. If you are going to leave the hypospadias alone, it's best, you know, sometimes I think they will give that advice that you should actually just circumcise. And that's not the appropriate thing, because if you ever did need any sort of repair, you want that tissue there in case they need it.
Yeah. Yeah. And I'm glad that you said that, because that was one thing that I learned in all the research I was doing to make this decision. And the reason we went with the surgeons we went with, because we didn't want to circumcise, but when it came down to it, he needed that tissue. It's like obviously the closest tissue that it could be. And years ago, I mean, this is probably decades ago, when they were doing these repairs, they were using like skin from your thigh. And I saw like reports of hair follicles like growing in the urethra because that they have hair follicles, or, you know, they'll use buccal tissue when they need to, but still, like, it's still not as close to the tissue you're born with as your foreskin.
Yeah, absolutely. So that is definitely, I think that's worth saying in case anyone's
Agreed.
listening and
Agreed. Yeah.
and I don't know what the way forward is if you've already chosen to circumcise and then I'm not sure.
Yeah.
Honestly, I don't know that much about this. I just know my lived experience as the parent of my son.
Mm-hmm.
And again, so this morning, I was like, okay, I didn't tell him I'm going on a podcast, but I said, and he's 7, so he's older. We can have bigger conversations. And I feel like it's been a while since we've talked about this, and maybe long enough that he wouldn't have any memory of us ever kind of, it's not like we've had a big conversation like you were born different,
Right.
but we've had little bits of conversation around the tissue of his penis, basically. And early on, I did work with that part of his body, and I can talk about that some, but it's been a long time. And I never touch that part of his body unless there's an issue, something I need to look at or something like that. So this morning I just said, I'm going to be speaking with a mom and dad today, and they're trying to share information about this condition that, I can't remember exactly how I said it, but, I said, like, you were born with your foreskin not going all the way around. And I said, could I work a little bit with your penis this morning, like do the type of healing work that I do so that I can better talk about it? And he was like, okay, like he thought it seemed strange, but he was totally fine with it. And so we just had this beautiful conversation while I did this, which what I did, I can describe, is essentially a myofascial pull, so traction of his penis to really feel if there were restrictions there. And so I just sort of grabbed hold of his penis at the base, and it's the same way I teach women how to do a breast pull, for example, or it's a little bit different with something like a leg pull or an arm pull, but the idea is like you pull the tissue away from the body till you feel that there's a barrier, and then almost just trace a little circle. So I was holding his penis, pulling it away from the body till I felt a barrier, tracing a little circle and just feeling for, is there a direction of restriction that I'm feeling? And I would highly recommend this for anyone who has done a surgical repair, because I don't think it could do any harm. It would definitely, you'd want to wait until the repair is fully healed, at least 6 weeks, longer if you have any worry about it. And just pulling away from the body and finding that direction where there's the most kind of tugging, and you can just feel that there's like a little something pulling deeper in the body, and then just holding there. The idea is that you will hold for 3 to 5 minutes at a minimum to really get into the collagenous part of the fascia. And from there, you might feel that there's a little bit of release, or you might feel a little unwinding where kind of it feels like things soften and that you can get a little bit more traction. But that's what I did with my son this morning. And we could feel that there was kind of one little strand or one direction that seemed to have a little bit more tugging. And so as I was doing this, he was asking me questions. And I said, when you were a baby, we took you to see a doctor who does surgery, and they thought you should have a surgery because a lot of boys are born with the same thing that you have, where your foreskin doesn't wrap all the way around, but most boys have it going all the way around. And I said, and where the pee comes out, it's a little bit lower. So you could see it. For him, it was it's kind of like at the bottom of the head of the penis.
Yeah.
Sorry, I don't know my male anatomy as well.
That's okay. I think that'll relate most to listeners anyway.
Yeah. Excuse me. And so I was just talking with him about this, and I said, we decided not to do surgery because you weren't really having any problems, and I didn't want to take the risk of having surgery. And if you ever want to have surgery later on, you can do that. And he was like, but it's okay to be different. Aww. And I was like, yeah, yes. It absolutely is okay to be different. And then I just said, and actually every penis is different from each other. There's none that are exactly the same. And I said, if you saw your friends' penises, they're all going to be a little bit different. And some of them are going to be circumcised. I said, like daddy, and some of them are going to be uncircumcised like you, and some of them are going to have the pee hole in a different place. And it was just kind of a beautiful, it was amazing to me that he was just like, but it's okay to be different. Yeah. And he didn't seem to be bothered by it, but this is definitely like, I want to follow up on this conversation because, like I said, it's been a while. And it does feel like an important thing to continue talking with him about, you know, like he's old enough now that we can have this sort of conversation. And I basically, I didn't say anything about like, you might not be able to have kids. I really don't think that's even a possibility of an issue for him that's related to this.
I'm really interested that they said that based on like the degree that he has, because like our son's urethra was like at the base, like right above his scrotum. Like there would have been issues reproducing the, you know, like the old fashioned way, right? Like there's no way that it would have traveled where it needed to go. So, but I always wonder this, like when there are more mild cases, because like, especially if they're not circumcised, like no one's really going to know, you know, like everything still goes where it needs to go like that. So, yeah, I'm interested. And I know like you probably don't have the answer on that because I think you guys consulted with like one urologist, but that would be like my question to some of them. It's like, well, why wouldn't it work if it's a very mild case?
Absolutely. And I think, you know, I don't want to just hate on surgeons because they serve an amazing purpose in our world. And again, I think they're biased to that type of work. That's the type of work they do. I was coming to them with, you know, my curiosity, which to them felt like a problem. And
they had a solution.
Exactly. Their solution. And so, for sure. I didn't have any conversation with my son about that. I would, you know, when he gets to that age, if he's having problems or when he's an adult or, you know, whatever. But I just said, you know, they told me that you wouldn't be able to stand up to pee. And he was like, well, that wouldn't even be that big of a deal if I had to sit down to pee. And I was like, well, you know, I was like, it is pretty normal for boys to stand up to pee. You might have felt kind of different if you couldn't. And he's like, but I can. And I was like, yeah, you can. So, I mean, for us, that just, again, it was a mild case. And I think, sure, there are people who get a lot of, they choose surgery in their life, you know, whatever that cosmetic sort of surgery is, a nose job, a boob job, all the things. But most people are choosing it if it's just what is needed. And in our case, it just didn't feel like it was actually indicated or needed. And I have a curiosity around, you know, what will happen over time. And like I said before, I think just as parents, we just want to do the best thing we can for our kids. And it's hard. It's hard to make the call and to know what the right move is. And certainly if we had felt like we wanted to explore surgery more, I would have absolutely done the same thing as you and gone and gotten second opinions. And it seems like most people that choose this path, and not most people, but the people that end up, so I don't know, were you with Snodgrass? Is that and he's kind of like the famous, I feel like his clinic is well known as being really good at what they do. And I think that that's interesting to me. Like, why aren't there more, why aren't there better urologists around? Like, why is it just this one place in our entire country?
Agreed. And because it's one of the top, like most common birth defects in boys. So it's needed. I also would love to go into a conversation with you when we get to the fascial part. Like, I think these midline defects are going to become more common as years progress. They already seem to be increasing, at least from like the oral tie perspective. So I think there's something to be said about all of that. And when we had recently went back, we had chatted with one of the surgeons there, Dr. Bush, and she was telling us that they're looking for new surgeons to join their practice because they need more surgeons, right? And they're also, you know, like Dr. Snodgrass we all are aging. He's
getting close to retirement.
He's getting close to retirement, and he would like to be able to do that at some point. And like for us, when we were going through this decision, I remember those whole 18 months that we needed them. I was so worried about them and what was going to happen to them because I'm like, if they can't fix our son, if something happened to them, I would be devastated. And
Yeah.
I also wonder, like, how come there are not more? But and this is just like my opinion and like the information I got when I was doing research, like I watched, I think it was like a continuing education for surgeons. When I was watching that, like there just seemed to be some beef back and forth on like this perspective and that perspective. And I just think that we should really do what's best for these kids or for these men
Yeah.
in general. Like it's like if we know a certain procedure and a way of doing it has a higher success rate, then let's do what's the most successful versus having a chip on our shoulder that it should be done a different way just because.
Well,
Yeah.
another thing I was thinking is, and I don't know how it was for you. I don't remember, and you can correct me if I'm wrong, if any surgeon or urologist talked to us about other potential midline defects, because I
No.
remember when we knew something was going on, but we didn't know much. I was like, man, I really hope everything's okay with his brain and his heart and everything else.
Mm-hmm.
Um, this I can get past, but is everything else okay? You can't just talk to a baby and ask,
Right.
is everything
Yeah.
else okay? But I don't remember getting talked to about other midline defects. But
No.
then when we were talking to one of your chiropractic friends, they were like, well, when there's one, there's three. I remember her saying about midline defects. So she's like,
Yeah.
when we told her about the hypospadias, she was like, there's got to be other.
Yeah, and he had a tongue tie, and we had that release because early on I was like, that's something I can control, right? Like I was holding on to control. I'm like, oh my gosh, like I have to do this. And in hindsight, I may not have, but yeah. So I didn't even know that hypospadias was considered a midline defect. No surgeon had told us, never even mentioned it, and being at home postpartum, I'm trying to get some of my continuing eds for chiropractic, and they had the Pediatric Chiropractic Society had a class on midline defects, and they labeled like the top three. They were like oral ties, umbilical hernias, and hypospadias. And I'm like, I'm taking this class. I'm like, I hope I was just like trying to just get all the information I possibly could. And then when I sat there, I'm like, oh my gosh, that makes so much sense. Like, of course, like this could happen. And I saw like the connection of it. So I definitely want, for you to go into a little bit more detail about that as you feel called to, because yeah, they're just.
Well, I'm just curious if any urologist even considers that, or if they just look at the one issue that they can fix with.
That's a good question.
Yeah. I don't know. And I have so much curiosity around it. I can't say I've done much actual scientific research. I know that these oral ties are increasing like crazy. I don't know. Have the rates of hypospadias also increased?
I don't know, because I find like it's hard to kind of find that information. I'm just
I
like,
bet it is.
in the back of my brain,
It's got to be.
I'm just thinking like it's obviously all got to be connected. And just being in an industry where I see lots of babies, just like, you do, like with oral ties and restrictions and torticollis and all that stuff. And I'm just waiting for like the other shoe to drop, where then they're adding hypospadias onto their intake form. And maybe more babies have it than I even know, because I don't think a lot of parents will divulge that information to their chiropractor, because they're like, well, what are you going to do for it? Which, in all fairness, like nothing but support you, and like be an open heart and someone to listen and to bounce ideas off of. But yeah, they definitely seem to be more prevalent. And ironically enough, and I don't know if people like this, but I'm going to say it. When I was in one of the Facebook groups semi-recently, there was a thread on like moms putting out there like why they think like their son had hypospadias. And there was one, and someone mentioned that their doctor told them it was because of microplastics. And I was like, oh my God, I got to get in this thread. I got to see what people are saying. Like, are they agreeing? Are they not agreeing? And there were lots of comments agreeing on it. So I was just very intrigued by that, because I mean, obviously, I think as we evolve, we know that there are different things in our environment that can negatively affect our makeup and our body. And who knows if that's true or not, but a little food for thought.
I mean, I feel like we live in a toxic world, and it's a combination of so many different things.
Agreed.
Some of which we just have no control over. I mean, we have a lot of control in the food we eat, how much plastic we're using, that sort of thing. But so much of it feels like, I don't know, it's one of those things. It's like, as we're sitting here talking, I'm like, oh, I'm starting to think about what it's going to be like for my kids when they are having kids.
Agreed.
And the fact that this now runs in our family, and
Yeah,
it might
I
be more
know.
severe for one of my grandchildren,
Hmm.
potentially, if they have kids, all that sort of thing.
Yeah.
Um, I, yeah, I've had an interesting experience with oral ties. I learned from a woman, an amazing infant craniosacral therapist, Lori Hendrickson,
Hmm.
and I hosted her in my office, and I didn't realize she was as pro release as she is. And we had such interesting conversations because I haven't done any sort of oral tie release with my kids either. With my son, it probably was indicated just based on I
Hmm.
had continual blocked ducts for quite a long stretch of time. I would say for like the first, well, he fell and severed his own lip
Yep.
tie around 9, 10 months, and I
Yep.
feel like things got a little bit better from there. Um, but I feel like it was for over a year, and I breastfed for a couple years, and so it just seemed like it was a combination of things. Though it wasn't just his oral ties; it was also me working a couple days a week, pumping. My body just does not like to be away from my babies
Yeah.
and breastfeeding at the same time. I've come to realize that for me, like breastfeeding, and this is how it was with my third baby. It's like I haven't pumped hardly at all. I take my lunch break, I go and nurse my baby, put her down for a nap, and it's just always worked out
Yeah.
so much better that way. But where was I going with that? So my littlest one was 3 months old when Lori came, and based on assessing her, she was like, "Yeah, I would absolutely have her oral ties released, and her function is there. Like her body's moving really well. She was meeting all her milestones. Was she only 3 months? Yeah, that's right. And it continued to progress that she just met her milestone. She's almost two. She's speaking a ton, full sentences, and just she's doing beautifully. So it's like I have a lot of questions around that.
I
I
know.
don't think it's wrong to release an oral tie the same way I don't think it's wrong to
Yeah.
do a hypospadias surgery. And it's so interesting to me that
Hmm.
it's so individual.
Yeah.
And with my children, there have been some, my daughter's 10. We didn't release her oral ties. She did have a lateral lisp, which meant some of her words were kind of slushy, still a little bit, even at 10, with a little bit of speech therapy. If she's not focusing on it, she can have a little bit of slushiness with her kind of like th and those sounds. She also had tooth decay kind of early
Yeah.
on
Yeah.
that we had to deal with.
Yep.
And I didn't even know that she had any oral ties at that time. I didn't have any indication. With my son, that was breastfeeding was just the challenge. And with my daughter, she has these oral ties, but I've worked on her a lot
Hmm.
more
Yeah, that's going to be my
at an early
question.
age.
Yeah.
I think like really the body work very early on can be so beneficial. And that's why I now
Yes.
have an infant fascia care course
Yeah.
that just teaches parents the simple things that you can do. The challenge is just that it's not that easy to come into parenthood. And if you're mothering another or parenting another child as
Yeah.
well, or multiple children, I just recognize that it's easier said than done to work body work into your routine
Yeah.
while you're parenting. But I do think it is really key and has been really key for my daughter. And I also think I had my third baby at home, and she just had a really peaceful entry into life. And again, it's one of those things. It's like, is it that, or is it just
Mm.
her constitution that she's just been the most chill,
Yeah.
happy baby? So easy meeting all those developmental milestones. I don't know. I don't know if it's that. I don't know. We can never really, I mean, there's so many different factors that go into all of these things
Yeah.
about our children, and then they're just different from each other. So
I know. And I
I
think
have
it's
a
like
lot
our
of
mom
curiosity.
brain too to like try to figure it all out, like have all
Yeah,
the answers. And like we'll never really know but we're not going to go back and like do it the opposite way to figure it
totally.
out, which is also like why, like just like you're saying, like we're super supportive like on whatever avenue people want to go down, like surgery, non-surgery, revision, non-revision. Like you have to make the best choice for you and your family, which is why I love that you're here. I love that you're sharing your story, because we do want to highlight too that not everyone gets surgery, and that's okay, and that there can be a positive change and a positive outcome, and that you have to do what's right for you. So
Yeah, I'm curious if I don't see or um, I couldn't even really feel what I think chordee would look like or feel like.
Mm-hmm.
I don't know if he'd still be diagnosed with any little bit because it seems
Yeah.
like things have kind of straightened out. But I have that wondering as well around just how much would be possible.
Yeah.
Like I would never tell a parent, like, bring your child to me a gazillion times and maybe we can just solve this hypospadias problem. But
Right.
I have that wondering, like,
Yeah.
is there just the fascial system and our fascial tissue just running head to toe through and between every cell of our bodies continuously with no interruption? I do have this wondering around these midline defects, and is there some unraveling that could happen that
Yeah.
would, I don't know. I want to believe that it's possible, but I know that it's much more complex than that.
Sure.
And I don't have any, test subjects
Yeah.
except my own son.
Yeah.
And his case was mild. So I think it's just,
Yeah.
I'm curious, I told him today after doing that, it's a little bit interesting and strange to be like, can I work on your penis?
Yeah.
I feel like I could work with his whole body more than I do at this point, having 3 kids and just not getting to nearly as much of that body work for them as I want to. But I also believe in my work, and I believe that really there are no places that need to be off limits when we do our own body work. I teach internal pelvic work for women.
Yep.
So important working with the breasts. And so for me to work with my son's penis, I think more importantly, teaching him and encouraging him to do that work.
Yeah.
That's what I wanted to do this morning, is like, I wanted to tell him, I was like, sometime if we're watching a movie or something, I might just encourage you to do this. And I think for him to be really feeling into that place in his body could be really powerful as well. And I'm curious if it will shift any of the, the kind of interoception, because I agree, like, he also holds his bladder. It seems like sometimes, maybe that's just a kid thing, maybe it's who knows, but I do feel like sometimes that happens. And so I'm curious if he'll notice any change, or if I'll notice any change in just kind of his behavior and way of being. He is someone that he also had some sensory, he was just sensitive growing up.
Yeah.
There would be stretches of time where lots of clothes didn't feel good for him. Sounds were kind of bothersome to him. He seems like he's kind of grown out of that, but he still will occasionally have these stretches where only like 2 pairs of pants feel good on his body. And we've done a tiny bit of occupational therapy, and mostly it's just been like, I've worked on him, or we've learned some tools and tricks that we can do. But again, I have that curiosity, like, is that this tension in his body, this hypospadias, that, it's manifesting as this very specific thing with his penis, but like, what's going on in this whole midline?
Lindsay wrote something in her intake form that just keeps coming back to me. She said, ask as many questions as possible. Know you have options, and let go of judgment of parents who have chose a different path. That last part is so important. Whether you're sitting in a surgeon's office right now, or you're 7 years out from a choice that kept you awake at night, you are doing the best that you could, and that is enough. Next week, we're back for part 2, where Lindsay takes us into her work as a fascial therapist, and I'll tell you, it might change the way that you think about your own body and everything you've been carrying through this journey. You don't want to miss it. If this episode resonated with you, we'd love for you to take one simple step. Share it with a friend, another parent, or a caregiver who might need to know they are not alone in this journey. Make sure you are subscribed so you will never miss an episode. We release new stories every Monday. And if you're looking for more connection, resources, or ways to share your own story, come join us on Instagram at bornforthisstories, or visit our website at bornforthisstories.com. Remember, whatever part of the journey you're in, the waiting room, the recovery, or the in-between, you do not have to carry it alone. We see you, we stand with you, and never forget, you were born for this.